Okay, so this is going to be a really brief overview of the different types of treatment in psychological disorders and abnormal psychology. And so we're just going to take it approach by approach. So we'll start with psychoanalysis. Every psychologist or psychiatrist is going to have a different opinion or viewpoint on how to treat, and it's also going to come down to different disorders should be treated different ways. And so there's just a different lens through which to look at treatment, and so psychoanalysis is just one of those. This is a Freudian approach, and it's a less common approach. Some people have a modern take on psychoanalysis that's called psychodynamic theory, but it just is a branch off of psychoanalysis, which was Freud's ideas. And so these are going to sound really similar to what you know about Freud. So first, we're going to start with free association. This was Freud's technique that he would use to have himself sitting in a chair taking notes, and he would have his patient lying down facing away from him, and free association would be, he would encourage them to just talk about anything, and he didn't care, and he tried to encourage them to talk about anything, and it didn't matter how trivial or embarrassing the topics would get. He just wanted them to talk, and then he would make connections with the things that they would talk about. Transference is a technique that he would use, that you would take the person and whatever issues that they were working through, they would redirect them onto the therapist. So the feelings, the emotions, whatever they were going through, they would direct them onto the therapist. And so they're transferring those feelings onto that person. Repression is just something that Freud would try to get past. Repression has to do with the pushing back of the memories into the unconscious mind. And so he was trying to uncover what has been repressed through psychoanalysis. He did this also through hypnosis and dream interpretation. Those were ways he would try to tap into the unconscious. And then I mentioned this earlier, but the psychodynamic therapies are a modern take on psychoanalysis. We're going to move on to humanistic. Humanistic approaches to treatment are focused on the person, on the person's self-development and just self-actualization and becoming the best you, basically. Carl Rogers was a prominent figure in the humanistic approach to treatment, and a lot of these are his ideas. So we're going to start with the client-centered approach. Client-centered just basically was Carl Rogers' idea that treatment is focused on the patient, and by that it means like the patient is driving the treatment, and then the therapist is like the supporter on the side. And so it was all focused and led by the person who would be seeking the treatment, and they're going to be the person who is going to be taking more time talking. The therapist is going to do less talking, and it's all really going to be driven by the person who's seeking out the therapist. Unconditional positive regard is another technique under the humanistic approach. It really is an aspect of client-centered therapy, and unconditional positive regard was Carl Rogers' idea that it was really necessary for therapists to take an empathetic approach and be very supportive of the patient regardless of what they say or do. So it doesn't matter where they're coming from, what they're saying, what they're doing. It was important to establish this relationship of empathy and support regardless of what they're coming in with and what they're saying. Active listening is another idea that is a client-centered humanistic approach, and what the therapist would do is basically they're trying to establish that empathy, and what they'll do is they'll have all of these like listening cues that they will give to show the person that they're listening, rather than like butting in and talking. They're going to actively show they're listening. So they'll be nodding. They'll say things like, what I hear you saying is, and then they'll just repeat what the person has said back to show that they have been listening. Or they might just nod and say, yes, I see, but taking a very active approach to listening to the person to show the person that they're listening and they care, but I know, active listening. Okay, the next one we'll talk about an approach to treatment is behavioral. Since this side is already up here, it says token economy. This is an approach to try to help guide behavior. This is a strategy that you would you see it oftentimes in like elementary classrooms where kids get tokens for good behaviors, and then they can trade those tokens in for something in the treasure box or a treat or a cookie. It works the same way in treatment. Obviously, it would look different for an adult than it would a child, but the idea is every time the person has corrected a behavior and they do a correct behavior, they're getting some kind of reward system for that, and so the incentive to correct their behavior is to get these rewards. So then some other types of techniques that are used in behavioral therapies. Aversive conditioning is where you're pairing things together, but what you're doing is you're taking whatever that behavior is that we don't want the person to be doing, we're pairing it with something they also don't want, so that they don't want to keep doing that behavior. A good example of this is nail biting. Say nail biting is the behavior that we're wanting to correct. Aversive conditioning is used when people paint on that bad tasting nail polish. So you're pairing that bad tasting nail polish with biting your nails, and so you no longer want to bite your nails. And so whatever the behavior is that the person is doing, we're pairing that behavior with something they don't want to try to train them out of it. Now, of course, there are some things that this just isn't going to work for, but that's a training behavior technique. Another treatment approach for behavioral therapy is exposure therapy, and there's different types. But just in general, exposure therapy is when you are exposing the person to the stimulus that is making them feel anxious. Exposure therapy is often used with phobias, and what you do is you present the object of fear to the person. And it's typically gradual, that it's given to them in small doses or in less scary ways until they're faced with their fear. Systematic desensitization is an aspect of exposure therapy, but what they're doing is they're doing that idea of exposing, but they're also presenting that object with something positive. So you're trying to get desensitized to that object through something pleasurable. An example of this would be like trying to make that object funny, or trying to make that object silly or enjoyable. And so you're trying to be exposed to this object in a way that is now pleasurable. Virtual reality is also used in exposure therapy. There's some things that you just aren't able to just fully be exposed to, whether that be heights or whatnot. You could actually have the virtual reality where you're exposed to that fear, but through the virtual realm. Cognitive therapy is an approach to treatment where you're always focusing on the thought processes and the thought patterns that are behind the disorder. And so this would be like a talk therapy that's always working its way back to changing the thought patterns. So there are different types of cognitive therapies. One is actually a joining between cognitive and behavioral. We call it CBT, cognitive behavioral therapy, where the psychologist will try to address the thought patterns that are destructive or self-defeating, and they'll try to change those thought patterns, but they'll also try to change the behaviors that accompany. And so it's kind of like a dual approach to adjust the thought patterns as well as working out the destructive behaviors also. Rational emotive behavior therapy is something that was created by Albert Ellis, and this is a confrontational approach to the thought patterns that are defeating and destructive. And basically, this is kind of like completely opposite of the humanistic approach. You're confronting that thought and you're saying, as the psychologist, this is destructive, it is illogical, it is irrational, and you're trying to show them in a way that you tell them straightforward that this is not healthy, this is not the way to go, and we're facing that head on. Facing the illogical thoughts and calling them what they are and working out something positive. Okay, so then we have biomedical treatments. This is something that you would receive if you go to see a doctor. A doctor is going to prescribe medication typically. They're going to go a route of psychopharmacology. They're going to prescribe some things that are more serious might be like a lobotomy. We're really not going to see lobotomies happen anymore. That's more of a past approach where the part of the brain is destroyed or punctured in some way. There are psychosurgeries that would be brain surgery if necessary. Those are going to be really invasive and only necessary for something incredibly serious. Some other types of biomedical treatment options would be, so I mentioned psychopharmacology. That just means the issuing of medication for psychological disorders. So there's different types. Antipsychotics would be something that is prescribed to schizophrenic symptoms or psychotic symptoms like hallucinations and delusions. Antidepressants are going to obviously be things that are given to people who are struggling with depression and lows. These are often going to affect serotonin. They're called SSRIs typically, selective serotonin reuptake inhibitors. Anti-anxiety medications are going to focus on people who have anxiety disorders. These are going to try to help the person alleviate those worries and apprehension. Mood stabilizers, this is something like lithium that someone would take for bipolar disorder. ECT is electroconvulsive therapy. This is where someone is issued a shock to the brain, and it's only going to be for someone who has a very severe case of depression. And it is seen as something that is positively helping people who have very severe persistent depression. Okay, so that was a really fast, quick rundown of the different type of treatment methods. I hope that was helpful. Definitely send me an email if you have any questions.